Hello, everybody. I'm Kelly Fleming, co chair of the Breaking Through Task Force, and your host for the Mental Health Mosaic podcast. Today, I have Dr. Sheila Davies with me, Deputy County Manager and Director of Dare County Department of Health and Human Services. She is here to give you some more information on the mental health landscape here in Dare County. So, thank you so much, Sheila, for being with us today. Before we get into our questions, can you tell us a little bit about your background and your role in Dare County and how your role pertains to mental health?
Thank you, Kelly. Happy to be here. Thanks for organizing this. Tell you a little bit about myself. I am the Director of Public Health, as you mentioned, and the Deputy County Manager. I actually was hired as the Health Director back in 2014. But interestingly, especially where it pertains to mental health, I worked for the health department here in Dare County back in 2007 to 2011 before returning to be health director in 2014. And when I was originally hired, it was to be the substance abuse project director for the county's new substance abuse initiative. This resulted out of a 2006 study that was done in collaboration with UNC that assessed the substance abuse gaps and needs for Dare County and identified quite a few things that the county could do to improve the situation for substance abuse care and treatment. It was a comprehensive plan, included starting an outpatient substance abuse clinic, which we did. Back then it was called New Horizons. We opened that in 2007, which Kelly, you were a part of that. Exciting work. Also launched a evidence-based prevention program for substance abuse work in the schools, which again, Kelly, you were connected with as one of the original educators hired under that program. And we did a lot of community collaboration work. So that really was where my background started in substance abuse. And when we say substance abuse, you really can't say substance abuse without linking mental health as well, because so many individuals battle co-occurring illnesses, both substance abuse and mental health. So in the landscape of public health in Dare County, we recognize for sure that mental health is part of our overall health and well-being, which is why it's something that we are invested in. We see where it's impacting our community in a negative way and has been for a number of years. So we've really been building up programs and staff and resources to help address these very challenging issues.
So, in your experience, what do you think are the most pressing mental health issues that are facing our residents today?
Yeah, it's a number of things. And we're getting information back from clinicians that we work with, some of our own counselors, our school nurses, and then just meetings that were in the public. And we're really seeing an increase in anxiety, depression, stress. I think all of these things have really been amplified in the past several years. The pandemic, sure, contributed, but also, economic uncertainty. There's a lot of housing pressures in our community and social isolation. Um, Substance use disorders, that's a significant concern. And as I already mentioned, particularly when they co-occur with untreated mental health conditions. Additionally, suicide prevention and youth mental health are big areas of concern for us in our community.
Great. Do you think there are specific demographics or groups of people that are maybe underserved and at risk?
Yeah, absolutely. Dare County, while we have a lot of tremendous resources, we are also considered a rural county. And rural counties often face more challenges in accessing care due to transportation, provider shortages, and just cost. Accessing care, can be really complicated with insurance requirements and regulations. Also another population or demographic I think particularly vulnerable right now is our young people, especially adolescents who are experiencing higher rates of anxiety and depression. It's a tough time. It always has been in adolescence, but you take a lot of the stressors now that adolescents have that we didn't have with the social media and the constant, all the different apps and the phones and the technology. It's a 24/7 bombardment for adolescents and having, learning to navigate that. Additional demographics that are particularly at risk or also our older population. They can be at risk due to social isolation, just the navigating life as you get older and, battling complexities of physical conditions that limit mobility and limit the ability to have the social interaction, that can just add and exacerbate depression with that population. And then, of course, we know that individuals with lower incomes or uninsured residents, seasonal workers, and those dealing with substance abuse or trauma are also particularly underserved.
So, how would you assess the availability of mental health resources in our community?
If I date back to when I first started this work, as I mentioned back in 2007, I would say we've come a long way. I can remember back then, especially when you looked at, co occurring illness with substance abuse and mental health, we had a handful of private providers trying to do that work. But there was the collapse of the mental health system that occurred a few years before that. So we were really in a dire situation. I think we've improved dramatically certainly we have with the number of individuals providing counseling, the number of private practitioners we have. Um, where we still though and also we have mobile crisis that provides 24-hour emergency crisis support, but we also had a larger agency that was providing substance abuse and mental health counseling, but the challenges that these entities are facing with staffing has been monumental. In fact, some of the resources that had built up and were existent have kind of dwindled back a little bit because of that. Thankfully, again, we have such a strong local provider network of licensed counselors, licensed mental health counselors, substance abuse counselors, social workers, and they're really providing, the backbone for what we have. Um, we still see though greater need, right? There's unmet needs that we have. We would like to see how we could get people more timely and efficiently to higher levels of care that they need. Um, our hospital does a great job with helping stabilize individuals when they're in crisis, but they're at the mercy of facilities that are far away to have a bed available to get people to the help they need. So I think DARE does a much better than average job for sure with the resources that are in DARE. And a lot of what holds us back is access to resources that are beyond our counties within our realm of management or capability or connection. And that makes it tough.
So, what barriers do you think individuals face when they are seeking mental health care in our community?
Biggest barriers that people face, transportation is an issue, again, kind of connected to our rural nature. And, sometimes individuals, they don't have a reliable source of transportation even to navigate within the county, but much less if they need to get support outside of the county. The Dare County does have a transportation system, and that works really well, but it's scheduled. So that's not going to be the resource when you need transportation in a crisis situation. So that's a challenge. I think the funding in insurance, having insurance or not having insurance or underinsured. A couple of years ago, the Community Foundation started an amazing project in collaboration with the Relief Foundation and ICO, Interfaith Community Outreach Organization, and DHHS, where they provided funding, seed funding, to get a program called Sound Minds in place. Sound Minds helps provide a stipend for treatment for individuals who need it, whether it's counseling sessions or treatment, with an established provider. And that's been really, really successful and has grown. The initial seed money was $40,000 in support of the 40th anniversary of the Community Foundation. But it's my understanding now, with community support and some additional donors, that is now in excess of $100,000 each year that goes towards helping people pay for their treatment here in Dare County for their counseling. And so that's been great. But that's, still people have greater need than beyond that, but that's helped. And then I think along with that funding is when people are thinking, okay, if I don't have insurance and I can go to another source to help me pay, that's great, but I have other competing priorities, right, with funding, whether it's housing or food or other access to healthcare. kind of challenges.
So, how do you believe stigma surrounding mental health affects individuals that might be interested in seeking help?
Yeah, sadly, I think stigma is still very real. People are, they can be very nervous. It can prevent them from getting help when they need it because they're worried about someone else finding out. Could be, how they would be perceived by others in the community. I say that it's sad because, you don't see that, excuse me, you don't see that same stigma around physical ailments. And, I hope and pray that eventually our society will recognize that mental health and substance abuse, those illnesses, mental illness and substance abuse illnesses, those are illnesses just like a physical illness. There's a lot of really great work that the Breaking Through Task Force is doing, and you've had great success in what you're doing to try to help reduce that stigma. I think it is improving, but I think, as this work continues, I hope people will realize that reaching out for help is not a sign of weakness. It's actually a sign of strength. To have the strength to say, hey, this has gotten beyond what I can control. Let me reach out to someone who can help me. That is so powerful. So I hope we can keep pushing that message and changing
Absolutely. In your opinion, what steps could we as a community take to increase awareness and work towards reducing stigma?
I think the more we can talk about it, right? We need to normalize these conversations. I think this podcast could have a great step in that direction. I hope that we will be able to push this out and get people to realize that, that having these conversations is the first step. I teach a class on kind of temperament and personality, learning about our personality. And it's interesting. One of the things in that class, it's called True Colors, but one of the things in that class is called having courageous conversations. And in that context, it's having courageous conversations about conflict navigation. Most of us love to avoid conflict and we don't want to have to talk about it, but we go through some steps about, how to help people have those courageous conversations to break the ice to start navigating conflict. Well, I see that as a great parallel for people who unsure whether they want, unsure about getting help or worried about a stigma or whatnot is, have that courageous conversation, have it with reach out to someone with the Breaking Through Task Force, reach out to one of the clinicians, reach out to a school counselor if you're in the school population, if you're a student. There are plenty of people. Our community has really been bolstering the amount of people who have the skills and background and expertise to help navigate these complex illnesses. So I hope that people will start having those courageous conversations and getting more help that they need.
So, what support services are available for our residents through Dare County Department of Health and Human Services?
Well, thanks to the Dare County Commissioners over the past, about 3 to 4 years, we have been able to utilize funding to start building a team to help with mental health and substance abuse. In our clinic at the health department, we have 2 full-time licensed clinical social workers who are seeing clients of social services, patients of the health department, and helping them when they've been identified as needing support and needing counseling services. We also have a part-time psychiatrist. She is with us every other Friday for about 4 hours, and her referrals come from our 2 clinicians that are working in the health department. In addition to that, just this year, we have started our school-based counselor program, our mental health counselors in the schools. We have 4 individuals that are working in all of the Dare County schools. They have different schools that they're assigned to, but that includes elementary all the way to high school. And they work directly with the school counselors to take referrals and meet with students who have been identified as needing support. And so those are great from the, assessment and treatment and ongoing support perspective. And then we have some amazing prevention work that's going on. The work that Kelly, you and your team are doing through the Breaking Through Task Force, your connection with the counselors in the community and just that coordinating piece of communication and facilitating that. That's super strong. You work in concert with the Saving Lives Task Force that focuses on the substance abuse needs in the community. So all that is just, really strong asset-based work that's happening. In addition to that, we are actually starting a study with UNC Chapel Hill to re-look at or kind of update the 2006 substance abuse community health needs assessment was done. But actually, this assessment is going to look at behavioral health. So it's going to look at both substance abuse and mental health and provide a landscape analysis based on data, primary and secondary data, to give us a more updated picture of where are the gaps and needs in our community.
Could you share a success story or an example of a positive outcome you've witnessed in your work?
Yes, the deep sigh was there. There are a number of them. Uh, some of them can get emotional. I will bring up first and foremost the amazing work that I think was done on the suicide documentary that you all did as a Breaking Through Task Force. That is such a powerful piece. And hopefully there's a way with this podcast, maybe as it's getting promoted, to put a link to that. Because I think if people have not seen that, even the trailer or the full thing, that's just so powerful. The individuals that spoke up and shared about their personal experience being impacted by suicide is just so touching. And I think that went a long way for, starting off with a really bold statement about breaking the stigma. So that's been, I think, a great success story. Um, and then we have heard some great success stories in our schools with parents reaching out to the counselors that have been so grateful for the work that they've been doing with students. We've had students who started off, really struggling with a school attendance and even passing classes, to then getting on track, getting the support they needed, and finishing the year with honor roll. So some great, great stories. Yeah.
Awesome. How would you say your work has impacted your own perspective on mental health and wellness?
Prior to, gosh, if I date back to prior to 2007 and getting involved in public health, I really was only on the periphery of the impact that substance abuse and mental health can have in communities. Certainly, in the almost, 25 years, it's hard to say that, but in, being involved in this space, I've realized, and I went back at the time when I first started in this work, I was in, um, my late 20s, and now I don't mind sharing in my early 50s. So in that span of time, I have learned how much individuals and communities are impacted by these illnesses. You really don't have to look very far um, to see a personal impact. And even in that amount of time, we've had a couple of situations in my family and my extended family of individuals who have had direct mental health illness impacting us. And so, it took a personal approach to this as well. But when you look at it from the community perspective, there are very few people who could say they have not been impacted in one way or another. And I think, to me, when we talk about stigma, if we try to help get that word out too, that, you might feel alone when you're battling, whether it's as a caregiver or whether it's as an individual who's battling the illness, you may feel alone in this battle. But I can assure you, most everyone has been impacted either directly or indirectly by these illnesses. So there is a common ground there, and there's often a much stronger common ground than people realize. And so I think over my span of time working in public health and as the health director and with the community has realized that's, we talk about 6 degrees of separation or connection. I mean, it's much smaller than that when you really think of the impact mental health and substance abuse have in communities.
Well, so do you have any final thoughts or advice you'd like to share with our listeners regarding mental health?
No, I think the final message, and it's kind of the theme of what we've been talking about, Kelly, is, just encourage everybody to remember that taking care of your mental health is just as important as taking care of your physical health. If you're struggling, you're not alone. Help is available. Help is available in Dare County. More can be done, but there is help here. And if you know someone who's struggling, reaching out, providing a listening ear can really make a difference for that individual. So be there for others. Together, we certainly can build a healthier and more supportive community.
Well, thank you so much for your time today, Sheila. We really appreciate it.
You're very welcome. Thanks for including me.